Next, from the state capitol, we talk with two women promoting a greater awareness of Alzheimer's. We'll hear how the disease impacts those who have it and its effect on the family members and caregivers of those with the disease. This runs about 15 minutes.
Robin Harrison and Kathy Perkowitz, thanks for joining us on the Illinois Channel. And we're here in the state capitol, and there's always lawmakers here, and there's always lobbyists. But sometimes we have what I would call regular people here, such as yourself, who come and lobby for or either an issue or to make a greater awareness. And you're both here, as I understand it, promoting greater awareness of Alzheimer's. Robin, let's start with you. You actually have been diagnosed with Alzheimer's, is that it?
Yes, I have, 4 years ago.
Tell us just a little bit of your experience, how you came to realize that you were suffering from a disease and how you happened to be actually diagnosed.
Well, I wasn't able to start counting money. I was having a hard time counting money. My short-term memory, my husband would tell me something and maybe 3 minutes later I would repeat the same thing to him. I remember a while ago, well, when it first happened, I'd gone to the grocery store. I came back with 11 loaves of bread. I don't know how I got 11 loaves of bread, but that's what I came back with. I can't go to a grocery store. I went to one that I don't normally go to. I was gone for a very long time, and I had to call my husband because I didn't know where I was at. And that's when we ended up going to a doctor who did cognitive testing, and they would read you stories, and you'd have to remember it, and I couldn't. Then they finally did a PET scan, which they thought it was a brain tumor, and then they saw the deposits in my brain, which came back as Alzheimer's dementia, because there's all different kinds, and I had the Alzheimer's dementia.
What is the treatment for the illness?
There is none. There is no treatment at all. It's a terminal illness. There is medicine, I'm trying to think of the words.
Aricept and Namenda.
That's it.
And quite frankly, neither one of those medicines, and I'm not a doctor, but neither one of those medicines will slow the progression of the disease. There is nothing out there. They sometimes help symptoms for some period of time, but there is nothing out there.
No cure,
It's the only top 10 disease of cause of death.
Right.
There's no cure, there's really nothing out there. And it's with the baby boomers coming of age, it's going to affect more and more people. So we're here just to bring awareness, because whether or not we have money in the government right now, it's all about awareness, and there's going to come a point when we're all going to have to be involved with this. At this point, we're involved directly,
right, exactly.
but it will affect everybody eventually.
Well, and I was going to say, and Kathy, your husband at a very young age, actually, about 52, was diagnosed with the disease.
That's correct, and
we tend to think of it as only someone who might be in their 80s or above, like Ronald Reagan was.
Right.
And Robin, you're a young lady yourself.
I was diagnosed at 50, but they don't even know if the medicine at her husband's age or mine works for anything.
Yeah.
But you have to take it. You just know, you don't know, because it's really only been for people over 65. Mm-hmm. But you just test it out, because you don't really, what do you do?
I just wanted to point out that also that Kathy and your husband had also been diagnosed, so it's not just what we would say an old person's disease.
No, it's very sad, because, like you said, generally you associate it with an older person. Mm-hmm. Robin was lucky to get diagnosed, because my husband and I got married in our 30s, and he was always kind of a really intelligent, kind of the absent-minded professor, highly educated, and what happened was everybody said, oh, that's just Bill, And so he was diagnosed late, which really, it was good for him, because by the time he was diagnosed, he didn't realize what was happening. It was devastating for our family. Our children weren't even teenagers when he was diagnosed. They've had to live with this disease. Nobody will understand what it's like unless you've had to live with this. And I'm involved. The Alzheimer's Association has done so much for my family, as far as just providing a voice, and I'm involved in this for my children and for everyone's children. Nobody should have to go through this. It's cancers, all diseases are horrible. My family has had almost every single one of them. I can promise you, Alzheimer's disease or any kind of related dementia diseases, especially when it's when you're younger, but at any age, is a very, very difficult and complicated disease to have to deal with.
They call it the long goodbye.
Yeah.
They call Alzheimer's the long goodbye.
Yeah.
But I really feel it is worse on the, what's the word?
Families and the caregivers?
The caregivers, yes, that was the word. I think because they get to watch it, where I don't get to notice it as much as she probably notices it.
Well, and that's what I want to ask at the for. First of all, you're here, as you already said, on one hand, just to raise awareness. To what extent? I guess there's experimental treatment going on. Hopefully, there's some breakthrough at some point. But if we don't really have a cure, do we need more funding of research? What would a government, whether at the federal level or the state level, do you imagine could do? Or is it that we just put more money into things like nursing homes? I mean, based upon your own examples, what is it that you would want someone to be aware of aside from just the fact that Alzheimer's is out there?
Well, it's interesting. In just the most recent years, the National Alzheimer's Project Act has been enacted. It got 100% support in the House and Senate. Again, Alzheimer's disease it's not politically aligned one or another. And they went around and they had public forums. People spoke at those forums and gave input. And now they are starting to work with the National Institute on Health. And so it's really about, if you want to know more what you can do, go to your local Illinois, for us it's the Illinois Alzheimer's Association or the Alzheimer's Association.
And what is the website?
www.alts.org is the national. The Illinois one, there's links all,
www.alzheimers.org.
Yeah. Right. And it really, there's just a wealth of information there. But as far as, it's just one of those things that when my husband was diagnosed and when I was trying to navigate the system, I was like, well, why isn't there more out there? I don't get this. This disease is over 100 years old. And it's because, there's no survivors.
No.
And the caregivers and those family members are so tired. And they have been through so much. They want to move on with it. They want to start having a life again. And that's the problem, is your life is it's changed as you will ever know it. And so, excuse me.
Is it worse than you have children and that changes everyone's life? Is it?
It's, I'll never forget, telling my kids that, I am so sorry your father has this disease. I would never have wished this upon my children, to watch your father, who is a bright, intelligent man, not even really know him as a bright, intelligent man.
Progress back to.
Yeah, but he had a daughter from a prior marriage who saw the progression, and
right.
even more so. So, she knew him more as an intelligent, successful man. And as time went on, because he was so young, doctors thought he was fine. I'd go in and say something's wrong, and they'd kind of roll their eyes, going, "Oh, the wife is crazy." And it's hard when they're younger. Mm-hmm. It's much harder. But at the same time, I have come to learn how to. It's important to anybody going through this disease, whether you're young or old.
Right.
We don't do enough for our elderly, disabled people. It's more about caring about people.
And maybe some of it is more about information sharing, as far as what resources might be available. Sometimes you just need to get away, but you just can't walk away if you have someone you're taking care of.
Right.
And maybe it's to have a daycare or something where you can just drop off your loved one and have them watched while you go about your own business for a couple hours.
You can't, because it's so expensive. The money involved, and even nursing homes involved. You really have to have a lot of money to put somebody in a nursing home, or to have a caregiver come if it's not your spouse. I heard they talking about paying your spouse to be your caregiver. They don't say how much it's going to be, but really the only way to find the cure, like I donated my brain to Rush Hospital in Chicago to hopefully find a cure. I don't know who else anybody's gone through there, and I also donated my organs because you can't donate them to any other person anymore. Once you have Alzheimer's, they won't take your organs to give to any other person who needed it. So I donated my whole body really to Rush Hospital in Chicago.
What is the prognosis? Is there any length of time from diagnosis to when one passes?
They gave me not till past. They gave me before I am not, what's the word? Okay, that would be a word. 8 years. I have 8 more years left.
It's, it varies from, people, my husband.
May I ask, guys, how do you deal with that emotionally?
For me, I just take it one day at a time. I just had a daughter get married, so that was good. It upsets me because I have a son who is mentally impaired, and he kind of worries me a lot. My son worries me very much so. There's no group home for him, so that part's kind of hard. But other than that, it's hard on my husband, so I just try to kind of put on a front for him. We don't know where it came from. They say it's a genetic disease, but we have no idea what part of the family it came from. My kids, one daughter who got married, she already shows signs of having a memory problem. She's already been tested. She has her master's in teaching, but she had to have it done to her verbally because when you read, like I can't read anymore. So when she was trying to take the test for teaching, she couldn't do it. And by the 5th time, they told her to go take her testing, and she did, and she's already memory impaired.
And how old is she?
29. Yeah.
And I'm sorry, Kathy, you were saying?
Oh, I don't even know. The children is really the difficult thing. For me, it really becomes about them, and it's our future. And 1 in 8 over 65 years of age, 1 in 8 people
under 65, are
going to be diagnosed. And the baby boomers,
every 69 seconds, they say somebody's diagnosed with Alzheimer's.
It's huge.
And we have obviously the largest population generation, I should say, ever aging, the baby boom generation. We talk about reform here in the Capitol, which is significant, but the other major cost factor of the state budget is health care.
Right.
And it's going to be not just what the state is, partly what the state is paying for the indigent and those who can't afford payments, and certainly when you're talking about 24-hour care.
Right.
This is going to be another cost factor looking forward for society that's going to be measured in the billions of dollars annually.
If we could come up with something that would actually slow the progression of this disease,
right,
that would be have a significant impact
if you could
on
still
Medicare.
Work.
Because they're showing that the numbers, the Alzheimer's Association has all these numbers available too. It's incredible. It's like the cost for caring for someone with Alzheimer's disease is tremendous.
Right.
If you have cancer and Alzheimer's disease,
right,
your cost automatically triples. It's just incredible, the cost of this disease, and people don't get it.
Well, the thing with cancer, though, it's not terminal.
Always.
Cancer isn't always terminal. Alzheimer's, though, is always terminal. There is no cure for Alzheimer's.
And of course, long before maybe you're terminal, you just can't care for yourself anymore.
Right, and they say that Alzheimer's...
We're running out of time, so I apologize. I want to thank you both for joining us. Good luck to both of you, and thank you for sharing your stories.
Oh, thank you so much.
Thank you for taking the time.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.